Hi all, mental health nursing, a new topic from unit 6. Before starting the disease condition, we have to know some treatment modalities. Okay, so today we are going to deal about somatic therapy. In your syllabus, you can check somatic therapy is ECT. ECT means electro-convulsive therapy. It's nothing other than shock. Okay. This electroconvulsive therapy was introduced by Binney and Serletti in the year 1938 April month. Okay. So what was their aim is like when a person has having any mentally problem, what we are going to give is like we are giving artificial current to the brain to induce grand mal seizure. Okay. I repeat. Definition is like it's an artificial induction of grand mal seizure through electric current to the brain. Okay. Now I said it is through electric current. With what effect will give electric current? Through the help of volt or through the help of electrodes. Now what is electrodes? Electrode is like big headsets you have seen, right? The same way the big headsets which we keep here, like it look like same but it's not headset, we call it as electrodes. Okay, now the placement of electrode is of two types. Okay, one is unilateral and bilateral. Unilateral means one side, bilateral means both side. Now unilateral, how will be placed? Unilateral, I said it's of one side, right? So it's like a dominant hand, like a person who is a right-handed, who writes with the right hand, who eats with the right hand. Okay. So what we do is like we place the electrode, unilateral electrode in the left side of the brain and give shock. Okay, and pass current through the brain. Why in the left side? Because left side of the brain is dealing or controlling the right side of the body. Okay. Now, I said giving shock to the patient, right? Artificially giving current to the patient's brain is known as electroconvulsive therapy. Now, artificial induction of current is of two types, direct, indirect. Indirect is also called as modified. What is direct? In the films and all, you might have seen giving, bringing the patient, making them lie down, giving shock, right? That is known as direct ECT. Okay, without the help of muscular relaxant or anesthetist, we are giving direct current to the patient is known as direct ECT. It was used earlier. Nowadays, we don't use direct ECT. Next one is indirect ECT. Indirect ECT is like we are giving them muscle relaxant plus anesthesia before giving a ECT. Okay. So you understand the types of ECT, direct and indirect. Now, how many times we can give ECT for a patient in his whole lifetime? We can, the first and all, we can give 3 times in a week. Later on, we can give it like once in a week, twice in a month. Okay, but not more than 25 times in the person's whole, lifespan. Not more than 25 times. Okay. Now, I said placing through the help of electrodes, we are giving current to the patient brain, right? Now, you will be thinking, where is the electrode placed? Whether in the here or here, right? It is placed in the temporal region. Okay. How? Where? We'll draw imaginary line, okay, from the tragus of the ear. This is the tragus, okay. Tragus of the ear to the lateral canthus of the eye. Okay, from here to here we draw imaginary line and in the middle we place the electrode. Okay, so electrode placing, I said unilateral is there, bilateral is there. Unilateral is more safer. Okay, so this was about electroconvulsive therapy. I said about applications, I said about frequency, right? How many volt we can give to the current? I said we are giving current, right? 70 to 120 volt shock we can give to the patient in 0.7 to 1.5 seconds. In 1.5 second, either the physician is telling 75 volt current. So in 0 to 1.5 second, 75 volt current should go. That's it. But we should not give above than 120 volt. Okay. Now, What are the indication? To whom and all we can give electric current. Okay. Depressive patient, we can give current. Okay. Then severe psychosis, schizophrenia patient, organic mood disorder patient. Okay. Then the person who is having suicidal tendency. Okay. Person is not responding to any of the drug therapy or taking poor intake of food, that we can call it as a anorexia nervosa. Okay, that are all conditions which you will learn later on. Okay, so this all patients we can give ECT. Then to whom and all we should not give. Okay, contraindication. The person's increased ICP means intracranial pressure. Intracranial pressure in the brain, if a person is having increased ICP, we should not give current. Then cerebral aneurysm, it's a condition which you are going to learn in MedSearch. Okay, cerebral means any problem in the brain. Brain tumor patient, heart attack patient. Okay, retinal detachment, like retina means in the eye. Okay, if there is any problem with the person's eye, we should not give ECT. Then pregnant woman, okay, we should not give any ECT. These are all the contraindications. Now, what are the complications? See, we are giving current to the patient's brain, right? Does it damage our brain? No, ECT will not damage the brain. But if it exceeds more than 25 times, it can cause some of the side effects in patient's body. Okay. What are the side effects? Fracture can occur, brain, skull fracture. Okay. Osteoporosis. Okay. Then dysarrhythmia, irregular cardiac rhythm. Okay. Respiratory arrest. Then the person can move on to coma also. Okay. These all are the complications of ECT. Fine. Now we are going to deal with the side effects. Once the shock is given to the patient, okay, the person will be having memory impairment. Where am I? What happened? Unsteady gait. The person is not able to stand properly. Okay. Drowsiness will be there. Poor concentration will be there. Okay. Muscle ache, backache, headache will be there for the patient. Mouth full, dryness will be there. Okay. Tongue bite will be there. In order to avoid tongue bite, we have to give a tongue depressor. Okay, and urinary incontinence will be there. Now, what is urinary incontinence? Means the person is not able to control the urine. Okay, that is urinary incontinence. This all are the side effects of ECT. Then ECT team, whom all is there to give a ECT, is like there will be a psychiatrist, anesthetist, because we said in modified ECT we are using, we have to give anesthesia to the patient. So anesthetist will be there and a trained nurse will be there in a ECT team. Okay. So this was about ECT. There is role of nurse, okay, that you have to write it as a homework. That role of nurse should be divided into 3 parts. Pre-treatment, intra-treatment, post-treatment. Okay. You write it and submit to me, and if there is any doubt or something, we will have a clarification about it. I hope you understood this section. Okay. Take care. Bye.